Well, we've had some really significant success in our ability to model the disease. There's a mouse model that has been in common use. We've been able to show that we can therapeutically administer the drug orally once a day, and the mice recover from their disease. So that means we can preserve the neurons in their brain. We can restore normal walking function, which is a key feature of the measurement. We've done this in a few different ways. When we go and look inside these animals after we've analyzed their behavior and their ability to walk and to communicate, we can see that we've protected the neurons in their brain and reduced or almost eliminated the protein pathology that's common in MSA and Parkinson's, which is related to a protein called alpha-synuclein. So those are all the kind of promising aspects that we would expect for a therapeutic benefit in human beings. So now we're looking to put the resources together to begin the trial. So hopefully in the coming year we'll be able to do that. Well, we're a company that believes that we have to prove a therapeutic benefit before going in the clinic. So most efforts in the industry to analyze what happens with a novel compound against the target you think is relevant, how it works, very often you just go straight into people with a hypothesis. And it's a 100% failure business, so we long ago adopted a policy where we would never do that. We reproduce the human disease in a lower animal. That's what we've done in Parkinson's with great success. We're doing that in MSA now. That provided a basis for doing so. We have two other models that we're also evaluating to really look in multiple ways at different time points in the disease to see that we can successfully treat a human being, because in the clinic, the people come to you at different levels of disability, different number of years since diagnosis, and they get harder to treat the longer they are into their disease course. So we have to be able to succeed for the majority of patients, and so we think our model-based approach is going to be ultimately more meaningful than other approaches that have been taken. So we're very optimistic about what's going to happen next.